is a microorganism that thrives in moist areas that include the human genital area as well as the mouth. The infection is also known as thrush, and though it does not discriminate in terms of gender or age, it mostly affects the reproductive organs of young girls and adult females because of the flora or nature of the female reproductive organ.
Just like grass, during the dry season, it withers out and dries and turns gray and completely, probably dries completely. But when rain comes, it absorbs moisture, and all of a sudden you see greenery all over the place. Yeast is the same. When it doesn't have moisture, it withers and dries and just stays put. When it gets exposed to moisture, it absorbs moisture and starts growing.
Yeast microorganisms are part of our natural environment and are opportunistic in nature. The female reproductive organ is acidic in nature and can naturally defend itself against the infection. It is until the reproductive organ is stripped of its defensive organisms or a woman's immunity is low that the yeast organism strikes almost instantly. This is why it is estimated that a woman will have thrush at least once in her life through one or more of the following ways.
Because you have handled an area that is contaminated with the fungus and touched your genital area with the same without observing good hygiene. Pregnancy is associated with reduced immunity. And when your immunity goes down, then of course any organism may take advantage of that scenario. And that is how come that in pregnancy there is increased risk of fungal infection over and above the increased secretions. Broad-spectrum antibiotics eliminate some of the protective organisms in the vaginal canal, which are supposed to be protective, that, like I said before, are there naturally for that particular purpose. The other likely route, which yes does occur, is through sexual intercourse. In other words, the male partner gets exposed to the fungus by having intercourse with a female counterpart who is infected, and then goes a long way to have intercourse with the other person who is uninfected. And that's a sure way of passing the fungus to the partner.
The symptoms for yeast infections are hard to miss. The infection comes with itching, especially in the external area of the reproductive organ or inside the mouth, accompanied by a discharge with an unpleasant smell. According to doctors, however, the main cause for yeast infection in female genitalia is douching, a common practice among women where chemicals are used to clean out the female intimate area.
It is quite common, and it's based on just being uninformed about what you're doing, because it's not helpful at all.
When you wash the female genital tract using certain chemicals and soaps, all you are doing is that you are interfering with the normal flora, that is the normal chemistry and biology of the female genital system.
Your intimate area has a specific pH. That's 4. 4 is the ideal pH for you to be healthy.
This pH environment is also destroyed by fragrant sanitary towels, wipes, panty liners, and non-cotton underwear. It is suggested that if one wants to keep yeast infections at bay, the use of natural products often protect the natural environment of the reproductive organ. These products can be found in your local pharmacies, and one such product is Vivag, a Danish intimate line that only uses natural acids that keep the woman's pH at 4, therefore not destroying the natural organisms and the acidic environment of the female reproductive organs, because it is the same organisms that prevent the yeast microorganisms from flourishing.
This product has no preservatives, no chemicals. It only uses lactic acid. It has no fragrances, which is a major cause of yeast infections.
The bottom line is stay natural and drink plenty of yogurt. Yogurt contains the right bacteria to preserve the natural flora of the reproductive organ. And use natural products that contain no fragrances or artificial preservatives. Ask your local chemist to advise you which products you can use to clean intimate areas to avoid stripping its ability to fight against the yeast microorganisms. Last, if someone in the family has a yeast infection, ensure to boil all their bathing materials and undergarments. Remember not to share bathing troughs, towels, washes, or underwear, especially with children and infants. The infection can plague their reproductive organs, mouth, and skin. Catherine Omwando for Healthy You.